Hi, this is Terry Kuti with DiepCFoundation. We are continuing our discussion in Scottsdale, Arizona with Dr. Tim Matatov from the Aesthetic and Restorative Breast Center in Phoenix and Dr. Patricia Clark, who is an oncoplastic breast surgeon at the Ironwood Cancer Center in Scottsdale. So, for both of you, I'm going to set up a scenario. I'm a breast cancer patient, because I have been, and I've just been told I have breast cancer. I was fortunate because my breast surgeon in Tucson gave me all my options, but I don't think that always happens. What often happens with the breast cancer patient, because that's what happened with me that was my mindset when I walked into her room. It's like, I have breast cancer. It needs to be gone. I need to get it out of my body. What other conversation should patients be having because they focus on the now and perhaps what they need to be thinking about? You told me a story a minute ago, Dr. Clark. Share that with me.
Right. So what my story is I have patients, as you just said, everybody when they come in, this is life-changing. They want the cancer out. Mm-hmm. I see breast cancer patients from beginning to end. I follow them 5 years. With oncoplastic procedures, we can reconstruct the lumpectomy defects, or we can prevent the defect from ever occurring in the first place by designing the surgery correctly. So I will often do an oncoplastic procedure for a patient, and they come back about 3 years later and they say, Dr. Clark, I didn't really care right back then what I looked like. I just wanted to live. Now it's 3 years later. I care a lot. Thank you. So, so we have Dr. Matatov here today with me. This is what we do, and I think there are a lot of patients in areas of the country where maybe their breast surgeons aren't thinking of that, or the patient doesn't realize that she can have a normal appearing breast after even a lumpectomy. So I'm going to have Dr. Matatov talk a little bit about this, but I think patients should ask their breast surgeons as well, what am I going to look like afterwards? The breast surgeon should hide the scars. The breast surgeon can bring a colleague in who does the reductions, who does a lot of the oncoplastic surgery, or they may even have the skills to do the oncoplastic surgery themselves. So
yeah. I mean, and here's the thing. I've often told people this because you're a plastic surgeon, you're an oncoplastic surgeon, but I think a lot of women think of plastic surgeons, the general public thinks of aesthetics, cosmesis when they think of plastic surgeons. You deal with breast cancer patients all the time. What advice can you give? And what should they be asking at the time of their diagnosis?
Absolutely. And like you mentioned earlier, that's the first thing when you hear breast cancer. You're not thinking about what am I going to look like down the line. And patients that are often undergoing lumpectomies will have a defect, and on top of that they will be undergoing radiation. And if you do not do something to prevent the future deformity, it is really difficult to fix that after the radiation damage has occurred. So it's ideal to do this at the time of the lumpectomy to prevent a future deformity. And when I see these patients 3 years, 4 years, 5 years out, and at that point, well, I'd like to fix this, it's difficult. Because at that point it's hard to do a mastectomy or breast reduction because you're worried about wound healing. So
skin's been compromised.
Skin's been compromised. Nipple is uncertain. I'm uncertain if the nipple is going to survive, and oftentimes I perform fat transfers or fat injections, which work a little bit, but to an extent that requires many procedures to fix. If this can be addressed at the same time, you don't have to backpedal. Makes just final reconstruction, aesthetic reconstruction easier. And just asking your breast surgeon if you're a candidate and if they have a plastic surgeon to refer to. And if not, I think finding somebody on a website or word of mouth will also help.
Yeah.
So pre-planning and collaboration.
Absolutely.
Yeah. And there's another thing with the term oncoplastic surgeon. This is a continuum. So we have things from very, very basic oncoplastic techniques, such as hiding the scars, all the way up to what Dr. Matatov does, which is microvascular tissue transfer. He can take abdominal fat and skin and move that up to the chest to reconstruct a new breast. All of that is oncoplastic surgery. At the more basic levels, the breast surgeons can do that themselves. There's a little gray area in the middle where some of the breast surgeons also have some training in the breast lift and the reduction procedures. And then at the more advanced levels, when we get into implant-based reconstructions and particularly the microvascular, that's in the realm of the plastic surgeons. So this is a continuum from very simple to very, very complex surgeries.
Yeah.
So I think basically what we're saying here is, really, I have to encourage patients, because I have been a breast cancer patient, to ask the aesthetic question. I was very fortunate, and these were not my doctors, full disclosure here, but I was so fortunate that my breast surgeon went ahead and told me about the aesthetics and went ahead and told me about the final outcome. So ladies, men, when you are diagnosed with breast cancer, ask the question. It's okay to ask the question about aesthetics and what can be done in an oncoplastic, in a plastic surgery setting, in a team setting. Ask the question. It's important to you, and it will be in a few years down the road, a few months down the road. Cancer treated first, but don't be afraid to ask the aesthetic question. Thank you both so much.
Thank you.
Yeah.